I did a white paper on this. I really dug deep into this, and I called it the symmetry of failure. And it was fascinating to discover that these numbers are so similar. You have about 60% of us that want to leave healthcare, 60% of our patients that don't follow through. And when you get to the bottom of it, it's the same problem.
Welcome to the Transforming Healthcare Coaching Podcast, where we're all about helping healthcare professionals like you create positive change at work, at home, and everywhere in between. So picture this. You're 7 minutes into a patient visit. They've just told you what's wrong. And without even thinking, you do what every part of your training has taught you to do. You fix it. You explain. You hand them the plan. You move on. And later that night, you wonder why you're so tired, why none of it sticks, why your patient comes back the next month with exactly the same thing. And so our guest today, Hélène Thériault, has spent more than 20 years inside healthcare, and she'll tell you something that might be hard to hear. The problem isn't your patient. The problem isn't you. The problem is the role you've been handed, this all-knowing fixer. And nobody has ever shown you that there's another way to show up in the office, in our clinical encounters, and in the way we are in the healthcare environment. So Helene is a master certified coach, which means that she has hundreds upon thousands of hours of experience, and she's an educator, an occupational therapist, and creator of a methodology that's quietly changing how clinicians show up to do their work. And in our podcast today, she's going to talk about the shift that she wishes someone had handed her in the clinic 10 years ago. Hélène, thank you so much for being here on the podcast.
Oh, you're more than welcome. I made that shift 24 years ago, right away. I'm so jealous of my students that get to hear about this approach right away in their practice as students. But thank you for having me, Lillian. Such a pleasure.
And so Hélène, as a master certified coach, she's a clinical instructor at the University of British Columbia, founder of Function First Coaching, and creator of the method called Dive into a Coach Approach, which has trained hundreds of healthcare professionals across North America. And Hélène, what I love about your work and what the honor is for you to be sharing with our community of healthcare practitioners and healthcare professionals is that you're not asking clinicians to leave their profession to become coaches. You're handing them a different way to show up in the room day in, day out. And so I think that's really unique about your training programs and what you're adding to the profession. So we had talked about the fact that all the way back in the day, there's a moment, all of us in our career, when the way we were trained and the way we were mentored is not enough. When we figured out, like, there's got to be something different. And so what was that moment for you when things changed and you said, we need to do this differently?
Yeah. There's two moments, actually, and when you merge them together, it completely shifted my practice. And I mean, a 180, complete shift. And it impacted every single future interaction I had with my clients going forward. The first moment, I was 14 years in my practice. This is why I'm jealous that student. Some people can get this, but appreciate that I was 14 years in my career, and it was a Thursday night. I was working in the community at the time, and I'm driving home, and for the first time in 14 years, I am not looking forward to going to work the next day. I am dreading going to work because it was a Friday, and it was my quarterly report writing day. In private practice, you write these detailed reports. You have these SMART goals you need to indicate in your initial assessment report. Every quarter, you're reporting how the progress is going. And I knew the next day for every single one of those clients, I was going to have to write goal not achieved. And that moment really struck me because I remember the car I was driving. I remember what I was wearing. I remember this visceral reaction head to toe that I should even think about leaving the profession. It is my identity. It is who I am. I've worked so hard to get here. But in that moment, I asked myself, what the heck am I doing? This is not my why for being in healthcare. Not one of my clients had followed through on my recommendations. So that was one moment. And there was a hard moment that I sat with. And you fast forward, the other piece that merged it together was the second moment. And this was months later. And I had taken on a clinical lead position. Still had a full caseload, of course. But that's what led to me landing in a coaching training. Because as we know, in a leadership role, I knew that those coaching skills were going to be essential. That's when it came together. That's when I realized the missing link, the missing piece of the puzzle. And I was not thinking in that training, I was thinking about my clients. I was thinking about my clinical role. And that's when it hit me based on your introduction, that I was showing up as an expert. That was my identity. And if I'm showing up as an expert, I'm the person with the answer. I'm going to be the fixer. I'm going to go see every single one of my clients. And if I'm the fixer, what am I going to do? I'm going to find the problem and I'm going to find the solution for every single one of you. And it wasn't working. Where I was landing was at a place that my clients were not following through with their goals. Now, I know later we'll talk about the research. Now I know why. They weren't adhering to their goals. And I was clearly on that path of burnout at that time as well, because I was loading my backpack, and I know we'll talk a bit about that as well. But those two moments, that Thursday night and that coaching training and getting that insight of that missing piece is really what led to this has to look different, because I wouldn't have stayed in healthcare.
Yeah. It is amazing to think that this is what we train for so long, like over a decade, right? To become the expert. And we cling to identity I think for many clinicians, they cling to that identity of whatever profession it is, whether you're a nurse practitioner, whether you're a PA, a physician, a nurse, like you feel like that being an expert in your field. In fact, you're told this. You're told this by your own culture, community, boss, but it costs us. And so what are the things that you notice and that you see with the students and the clinicians as they're coming out? How do you begin to point them towards that they should not accept this expert role? I'm sure most students as they're graduate, like, what do you mean I'm not expert? I've been going to school for 10 years for this. So what is that you have to point them towards or guide them to be able to see a little bit differently?
First and foremost, just because of that statement, it's reassuring them, hold on to that expert hat. It's inviting them to bring that expertise in a different way so that it lands for the client. And once they appreciate and understand what's the cost for us to show up in healthcare as expert, that helps to start to make that shift. So once they understand that this might help. There's a metaphor that I use with students, that I use in my clinical practice, that I've shared it in conferences. And for the clinicians in the room, I always get a nod when I share this metaphor. And I share with them, it's called the backpack. And it's an invisible backpack. And little did you know, I'm sure you graduate from medical school, healthcare school, here's your degree. And guess what? Here's this invisible backpack that comes along with it. And this is the piece that is not talked about, that every single time that you're going to do for your client versus with your client, load your backpack. Every single time that you're going to tell a patient what to do and not check in with them, how they'll move forward, put that in your backpack. Every single time you're working harder than your patient, which I was very guilty of, put that in your backpack. Every session that you show up and the person has not followed through on your recommendations, such as that Thursday day, put that in your backpack. And it compounds. And so if you're looking at the number of patients you see in a day, the number of days you work in the year, the number of years you've been working, it adds up. And so that Thursday night story, that was my backpack getting full. And at the time, for me to not realize, unfortunately, I did not have the training, the understanding of what burnout really was at that time. And so I went along, I don't know if you're using the stages of burnout, but I was well along on that path and I didn't catch it. So when I share, and so I share a lot of my story when I'm teaching this approach too, because if they can understand what's the cost of being an expert. And I also like to point to them too, then there's the cost for you for burnout. There's the cost for the patient that's sitting in front of you as well. Because if you're in that expert mindset, and this is what the research is showing us, is about 60% of our patients are not following through with our recommendation. with that expert mindset. And so if we can add on a different approach, still show up as an expert, it's needed. They don't know how to move forward with maybe this new diagnosis. They can't prescribe medication. It is needed. And so the message I try to add is stay there, just do an add-on and a different way of showing up with your patient. And then with organizations, and this is what I like to share in the presentations when they're present, is if the cost for not addressing this patient adherence and burnout, the cost is we're leaving the profession. The cost is for them, if they need to replace me, a healthcare practitioner, we're looking at $45,000 to $150,000. And if they're looking to replace you, a medical practitioner, times 3. So the numbers speak for themselves. We are seeing this adherence problem. We're seeing the burnout problem. And the research, and I did a white paper on this. I really dug deep into this, and I called it the symmetry of failure. And it was fascinating to discover that these numbers are so similar. You have about 60% of us that want to leave healthcare, 60% of our patients that don't follow through. And when you get to the bottom of it, it's the same problem. They're not. And what we're doing is we're trying to fix 2 different problems, but it's this medical approach, this expert approach that is happening. And we know that the studies are coming out for quite some time about the biopsychosocial model. And so that's what I appreciate about the coach approach, is it's helping with that psychosocial piece and starting to shift healthcare slowly but gradually, 1% at a time, as they're learning this. So that's how I try to support students, clinicians, to understand the importance behind this and the impact and the ripple effect that it has for them, for the client, for the organization, and the community that the patient lives in and they live in.
Yeah, that's really wonderful. I think also I really love the for versus with. And that's definitely one of those things where I do think that so much of the way we burn out in healthcare is because we think we're doing this for our team. We're doing it for our patients. We're doing it for, and then when someone else doesn't do their job, so you often see this in teamwork, because healthcare isn't in a professional sport now. If someone doesn't do their job, then we get angry and we blame, rather than how can we all empower each other to be able to be successful, to get the job done together. And so whether you're a leader hearing this and how this applies to have a coach approach as a leader, it's also how you have a coach approach with your patients, how you have a coach approach with the other professions in the teamwork that you need to deliver. And so I love that for versus with. And if we can just change that word, just the way I think a lot of times we teach in our communication skills, removing all the buts and making it an and. I've heard that sentence so many times. And it's always curious. I mean, it's a very different way of being, right? To be with people, to be alongside, to be together.
I think to your point, it's that mindset. And if we start to shift and being okay, yes, being the expert, but adding on, viewing our clients, our patients, if we're in the leadership position, viewing your staff as the expert in their own situation, because they really are. They really are the experts in their own situation, and really truly believing, and that's the shift, maybe an add-on layer for clinicians to use this approach directly with their patients, is really truly believing that they have the answer within themselves. And there's one story that just comes to mind as I share that was so powerful, that was shared with me recently. And it's a client that had a stroke, and she's probably 3 to 4 months into her recovery. And this OT started to use a coach approach with this patient. And maybe in session 3 or 4, this OT comes back and says, "Helen, do you know what happened that gave me goosebumps?" Because I talk about goosebumps all the time. She said, "Do you know what happened that gave me goosebumps?" She shared with me that I was the first person to really trust that she could have the answer within herself. And in one of our sessions, and when she realized this, that, wow, I still have the ability to come up with a solution. I still have that skill set. And she realized that in her session because this OT used a coach approach. And that client cried in that moment. She had no idea that this was still an ability that she still had. So it was really transformational. And from that point on, she made gains after gains in her progress. And that's one OT truly believing that you've got the solution within her and doing with, not for.
I love that. And so a lot of clinicians hear coaching and they either think life coaching like they see on Instagram, or they think executive and leadership coaching like what we do for healthcare leaders. And neither of those feels exactly how they might translate it to interactions with patients and their families. And so how do you like to explain what a coach approach is, generally speaking? So whether you're a PA, NP, OT, PT, what is a coach approach to that encounter?
Such an important distinction that needs to be made and also needs to be clearer to support practitioners, the research, to support decision makers. And we will see a big shift happening in the next couple of years as the research is really gaining a lot of momentum in that. First and foremost, I'll say a coach approach is not life coaching. That's the first thing I'll start with. And I'll explain the coach approach in healthcare can be done by any healthcare professional, medical practitioner, and they are doing this embedded in their clinical role. So it's not a one or the other. It's really an add-on to think of. So the healthcare hat doesn't come off. I'll also talk about a spectrum to help that point land. And then if we take your situation, your example, you're a doctor, let's say you're on that, as a doctor on that left side of the spectrum, an occupational therapist. And for you as a doctor, you're going to be prescribing, you're going to assess, you're going to diagnose, you're going to educate your clients. When you show up, because you also do leadership coaching, so that brings you to the other end of the spectrum. What changes there is it's completely client-led. At no point, you're agenda free. You don't show up to those sessions. You have no idea what leadership topic they're going to pick. So it's agenda free. At no point are you mentoring when you're using that true coach approach. At no point are you telling them exactly what to do. You're not diagnosis in that lane. The coach approach in healthcare lives in the middle of that spectrum. And that really here is you're showing up as the expert, but at some point you're going to decide, I'm identifying, for example, maybe a perceptual barrier. In your situation, it could be, I'm noticing that the patient has a belief about medication and I don't think they're going to follow through and adhere to my medication prescription. So I'm going to put my prescription pad down for a sec and I'm going to ask, tell me about your thoughts about these medications that I'm prescribing for you. So it's just a shift that you're adding in that moment when you're identifying a block.
And so I think the reality is, just like you're saying, that so much data has shown that we can think of professional coaches like myself and like yourself. We get additional certification. We have standards. We're observed. We have feedback. We have mentoring. We have supervision. There's a whole process to become a professional coach on one end of the spectrum. And just like there is a whole bunch of training and education needs to happen if you're going to become a NP, PA, PTOT, or physician, right? So there's on both sides. And somewhere in between, many of our clients actually do wonder, how could I become a coach so that I can become a better leader or a better physician? How can I take some of the things I've learned by working with a professional coach into my daily practice? And so I call it just like communication skills or palliative medicine skills, there's what we call primary skills, where everybody should have a little bit of understanding. And then, of course, not everyone becomes a hospice and palliative care specialist. That's one end of becoming subspecialty. So becoming a full professional coach like you and I, you don't need to have all of that. However, there are lots of different ways where you can begin your skills and add it to your toolbox so you're a more effective leader and more effective clinician.
Exactly. And that's exactly the gap that I identified early on. And that's how the dive into a coach approach, the coach approach in healthcare certification came to be about. Is my intent. We need people to know about coaching skills and use that in healthcare. And it's powerful. Like the first level that we deliver is self-paced 12 hours. And I just finished a program with a cohort of 800 and reviewing the findings this week, and powerful the statements that they share in their learning and feedback form after 12 hours. So a lot of shift can happen with 12 hours. And yes, to get to our level, to really use that formal coach approach, absolutely, it does take more time, but there's a lot of return of investment is what organizations are getting from a little bit of training and shifting that culture.
So that leads directly into my next question. You've spent years actually creating this methodology, the dive into the coach approach, this training program for continuing education for OTs and other healthcare professionals across North America. And so you really create this new middle ground, like the end of yourself, because really there are not specifically healthcare professional guided, clinician forward focusing, integrated teach coaching skills into daily practice. And so what is your evidence showing? And like, what is happening with this particular coaching training program? So tell us about the program.
Yeah, so we're capturing a lot of data. So the program is a micro-credentialing journey. And that was important to set it up that way because to your point, that level 1, 12 hours, that's when I work with organization, that's where we start. And the goal is often for everyone in the organization to understand what coaching is. In that 12 hours, they understand a model created by and for healthcare. They have a 4-step coaching framework, 10 techniques that supports them to use those 4 steps of the framework, 4 mindset metaphors. I've turned it into a fun way so that the information sticks because those metaphors are what will support them to shift from a fix-it mindset to the doing with mindset. And so starting with that, but we know that there are leaders in the organizations, they are clinical leads. There are people that in order to support the organization to maintain this learning, you're going to need your coaching champions is what I call them. So they will go, it's almost, you've gone through the International Coaching Federation route. It's like doing the ACC. It's 50 to 60 hour coaching education. This is where I get to in the level 2. And this is where people too are realizing, wow, this is harder than it seems, this coaching thing. It's easy to understand and it's so fun for us to teach it, isn't it? But it's when they start practicing. And so in that level 2 is 20 hours of training. And this is where they start the peer coaching. This is where they bring their specific case situations. And Hélène, this has come up. How do I deal with this with my coaching hat on at the same time? And so that 20 hours is really where it starts to become more second nature. And that third level for those coaching champions is really important because that's when they do formal coaching sessions with a paid client. And that's next level. It's so different when you're doing peer coaching compared to like real coaching is the terms I would use. And they get to experience that and the growth feedback following those core coaching competencies. So it's really in that second and the third level that those core coaching competencies are ingrained a bit more. It starts to be more second nature. And this is when you start to hear stories about how their habits are changing and that mindset becomes more natural. And it's important to have those coaching champions. It was really important for me I started with just a level 1 at the beginning. And I thought, we're not shifting healthcare just with this. We need coaching champions embedded because I can't be in every single organization. We need to have those champions that can maintain and continue through their team meetings, continue the peer coaching, and really maintain that language and the culture shift for the organization.
Yeah, no, that makes sense. Especially also because it's really hard. It's like a learning community, right? So I think even when I think about some of my facilitation and teaching groups with Vital Talk, faculty need other faculty who are able to be able to speak the language and also get support, just like coaches need other coaches for mentor coaching and also supervision to just know that what do you do when these situations come up? How do you handle different circumstances? And it's just to be able to create that community.
Yeah. And it's fascinating to watch it happen too between the leader and the clinician, because once everyone has that coaching training, I'll hear comments from the clinicians like, you're coaching me right now, right? To their leaders, like, you're coach approaching me right now. It's a fantastic way of learning and reinforcing it.
Yeah, no, it's great. It's funny because it's one of those things where in one of our communication communities, we often will accidentally say a sentence because, like you said, you eventually become embodied and it becomes a habit and you just don't see any other way of approaching a situation. And so, I mean, that's why I think it's really fun to be in learning with other coaches because other coaches have different ways of seeing things. And so it's refreshing compared to when you're in your own whole of just trying to figure out like what the solution might be with a particular circumstance. It's nice to have a wider lens.
Yes, absolutely.
Yeah. And so I'm curious in training clinicians, I try to just do one very small kind of workshop. And you're right. The very first feedback is, oh, this is really hard to be an academic coach. It's hard to be a peer coach. What's the single hardest habit to break when clinicians are trying to integrate this approach? Where do people get stuck?
I would say I'm seeing a pattern depending on the number of hours of training that they have. So after the level 1, so they have about 12 hours of training, the biggest challenge will be to listen actively. So that ICF number 6 core coaching competency. So they'll talk about it's hard for me to not interrupt, to allow that silence is part of it, and to not before they jump into solutions. So so notice before I jump into solutions, so they'll still say a bit of that in that level 1, but that's fantastic. The fact that they're pausing, they're really trying to be at that level 3 of active listening, and the impact in itself that it's having has been phenomenal. When people get to the level 2 at this point, they have 20 to 40 hours of training that they'll say that it's starting to become more second nature. And they're really working harder to ask that powerful question, for example, that will lead to insight. So they'll share things like, I'm trying to not just ask clarity and curiosity questions, just to ask those open-ended questions. They're trying to be, even if just that one golden powerful question. And in a level 3, and I just finished a cohort, every single one. So this is where they have 50 hours of training. I give them growth feedback, and they've just worked with 6 sessions. Every single one of them was about setting an agreement. So that's one of the main, the third core coaching competency is establishing and maintaining an agreement. They have one, but for every single growth feedback, I gave them your next step to make it almost like a smart set of contract to really get them to get to the solution, to get to the root of it much quicker. And that's the growth or the habits shift that I'm seeing as they progress.
Yeah, that makes sense. I mean, it's really not that different from actually our coaching journey, like in terms of just trying to figure out like, well, how do I actively listen? And for some of us, that actually is easier or already something that we had already incorporated in our practice. But figuring out what question to ask, because there are so many questions you can ask, and crafting it quickly within that moment is very different skills for different people. And then like, I really like your last part about the fact that when by the time you're in practice, really the question is, how can we be more laser-like or more specific with agreeing together this is where we want to go? Because if we can be specific, then at least we're heading in a more correct direction rather than an exploratory. I mean, we could get there. We get there the slow way. Some people still enjoy the slow way getting there. It's just that some people also really, for the bang for your buck, for your engagement, it is nice to have some wins along the way.
Absolutely.
Yeah. And so I'm wondering if someone's listening to our podcast now and has come this far, they're driving in the car and like, okay, I'm in, I buy this. I really want to try this, but they have a full clinic tomorrow. They don't necessarily have all the time quite yet to devote to at least the 12 hours of initial training. They only have a couple minutes per patient, maybe like 7 or 10 minutes. What's the smallest, concrete, tiny, actionable shift that you suggest to our listeners to try right now?
My invitation would be to catch yourself when you're stepping in that expert mindset. Catch yourself when, let's say I'm your patient, catch yourself when you're prescribing something to me and see if you can do an add-on. For example, and this was an actual situation where I had to coach the patient on, the doctor prescribed this person for the very first time medication. They have never had to deal with medication. So the patient comes in, Susie Q, you've got this diagnosis. These are the 2 new medications you'll have to take. So with this one 2 times a day, this one 3 times a day. Thank you for your time. See you next time. Done. At no point, and then you fast forward 6 months, 8 months, 9 months before they come to me and it's become a larger item. And the only thing what could have happened in that moment is if the doctor would have asked, Helen, I know this is the first time you're being prescribed medication. How do you feel about these medications I'm prescribing to you? And if they would have taken that time to ask just that one question, they actually would have gotten more diagnostic information. They would have realized, wow, there's a big perceptual barrier here with this person and their strong belief against medication. And they are not going to take it unless I go deeper and I solve and we work and we talk this through this coach approach conversation and we get to the bottom of it and we shift that belief. Because if that belief is not changed, she will not. And this was a diagnosis that in order to have a quality of life and have another 30, 40 years, these medications are needed. And so it led to something much bigger and all it needed. But I can also appreciate when the physician is sitting there as well, or the healthcare practitioner. And if I ask that question, I'm opening up a door, right? I'm having them, I don't know how long they're going to take to give me that answer. And I know that my next patient is waiting. I have a room of patients outside waiting for me. So I can appreciate that we may not want to avoid it. And what I share in those to those that are concerned about the time that it takes to do that add-on question, what's the cost? What's the time if it's not addressed?
That's true. A year. It's like 9 months, you said, right? A lot longer. And I think the other thing too, a lot of times like within team-based care, right? Like a lot of times it's really going to be, we do also have a nurse navigator. We also have other people on the care team. Even if we open up the Pandora and we say, we really appreciate your sharing that concern with me. And I also know I can't get to in the next 2 minutes. Is it okay if I share it with the rest of the care team so that social worker, nurse, everybody else can like be on the same page together, be able to support you through that? And they're like, okay, sounds good. And you're like, and then you write into the chart and then off it goes and then you do a little quick Teams message, right? Because a lot of times now we have care teams that we communicate across professions to be able to row in the same direction.
Goosebumps, I've shared that. This is how it should be. This is the vision that I have, how healthcare teams are working together. And this is why when I put this training together, even though I'm an occupational therapist, and when it first started was because my OT association inviting me to deliver. And I thought I cannot create something for just occupational therapists because I was being faced with the challenge of I'm the only one on the team using this as approach. And it's great and I'm making some gains, but boy, would I be so much more ahead if the whole team knew my language. And so you just spoke to something that I'm really passionate about. Yeah, thank you.
And I think it's funny because it's one of the things both you and I, both with our companies, we both have a very interprofessional slant in general. Many companies are very single specialty or single job description, potentially. But I do think that the reality is we do all work together. We can influence each other, both from an energy perspective, a leadership perspective, and as we'll see, a coach approach perspective. To get into a little bit more into the model. So let's say someone's like, okay, I'm in. I can easily take 12 hours. I can spend some CME money. And then I kind of want to go in further. You have, I think, maybe 16 techniques in your dive into a coach approach model. Could you just maybe show or teach our listeners just one of them today, just so they get a taste to see like, oh, what is this? And then maybe that might actually inspire them to commit to like the level 1 and level 2 training.
Well, one of the favorite techniques that I get a lot of feedback on is one that's called make a request. So I'll actually test it out with your listeners right now and I'll explain a bit behind it. But making a request would sound just like this. I'd like to invite all your listeners. And the request is, and when I make a request, you can accept it, you can reject it, decline it, or you can change the terms. My request is to think of a person I'm in your life right now. This could be a colleague, this could be a friend, this could be someone you're training with, a student that you think would benefit from listening to this episode, and send it to them by the end of the day. And so then I would finish off, do you accept, reject, or change the terms? So 2 things I did when I did that is I created a SMART goal. And when I'm doing this with my patients, with my clients, the SMART goal is aligned with our overall agreement that set a contract. So I set a SMART goal that's aligned with something that's of value, hopefully for the individual. And then the other piece, you're in control. You decide if you accept that request, reject it, or decline it. And of course, when I teach it, it's also very important. A big piece that coach approach does is it improves that therapeutic alliance, that therapeutic relationship. And so it's going to be, when I shared this with my client for the first time, I'll say, it's absolutely okay for you to say no. You're allowed to decline. So I just make sure that they're okay with this. And I absolutely encourage to modify the request. Maybe you'll say, you know what? I don't really want to take the time to find the link and send it to someone. I'm going to go for a walk with my best friend tonight, and I'm going to share my key takeaways about this podcast with her tonight instead. Great. It's serving the same purpose, right? And so just inviting them to adapt it. So make a request is a technique not always needed to be used, but it can be really powerful.
So interesting. I'm just thinking that from a leadership lens, for those of you who are more interested in like, how do I become a more effective leader and use these particular techniques? It also makes sense too that way, because we have so many projects and so many things that have to happen for our group. And so a lot of times people complain about how things are being run. And so as a leader, the reality is offering a suggestion. And again, you can accept, reject, or modify. And so in many ways, it gives agency back to the team to like, if we need this changed, then we need to figure out a solution. And we means not me, we means we. So here's an idea. And again, reject, accept, or modify. I like that. I like that.
And you can play with your words. I have students that will come back and share, like I use the word reject, but decline might resonate more for people, but you play with that formula. But yeah, and that's the idea, is it gives the other person ownership and it becomes their action plan.
I love that. So you've watched lots of people, lots of clinicians make this shift, younger, older, leader, senior, junior. What changes for them? So what's in it for them 6 months, a year in? You may have had some feedback. People come return, like they shoot you a message a couple months later, just like, hey, things are going well. Things are not going well. But I'm curious, like, what have you heard about what helps their journey as a clinician or leader?
Yeah. Well, first I have a folder that I called success stories. And when I have a challenging day, I open that folder, and I'm so privileged in where I sit in hearing the impact that this training has. And for us, what we monitor 6 months, 12 months later that we hear from organization, we look at, is it preventing burnout? So we're getting high scores on that. Is it helping with retention? Therapeutic alliance is what they'll report. Improved communication, not surprisingly. And then the biggest piece that people will share subjectively when you ask in the learning and feedback form, when you follow up, they'll share stories about burnout. And it's interesting because when you look specifically, there's data. It's hard to find clear data. Is this coach approach helping with preventing burnout? We can't answer a solid yes or no, but the details I get in one of the last forms, they called it when I asked what's one word that would describe this training, and that was just a 12 hours, burnout crusher. I was like, wow, that's powerful. And so those are the subjective stories that come our way. One of my favorite one that I like to share is very early on when I started to do this training, she was a chiropractor. And she said, Helene, little do you know, she followed up with me months later. She said, little did you know, when I sat in your course, next to me was my letter of resignation that I was going to give to my employer that very week. And she said, I do your course. I get a ton of these ha-ha moments. I'm like, hold on. She starts doing things differently, shifting her mindset from that expert mindset. And 4 years later, she's still in the same role. But she's like, it was such an eye-opener for her. And those are the success stories that keep me going when things get challenging. Yeah.
That's amazing. So, Helene, thank you so much. This was exactly the conversation I really hoped it would be, just so generous and practical and honest. So where can our listeners find out more about your work, bring function first coaching and your programs to their organization, their private practice groups, their universities, their graduate training programs? How can they find you and work with you?
Well, what I did is my team put together a link to make it easier because I had gathered so many resources that I thought, okay, this is going to be way easier if I could just one link. So there's diveintoacoachapproach.com/transforming healthcare coaching. So I'll share the link with you because in there is for those that are readers, there's going to be that white paper if people want to make a business case for using a coach approach in their practice and their organization. So there's some bedtime reading. There's a great article about AI because a lot of people are worried about AI and is that going to take. So there's a neat article on that supports the use of coaching skills to support you with that transition. And in there as well will be included the LinkedIn to the best way to contact me, my email, my calendar. And then the one that I hope leaders are able to access is the coaching culture quiz. That one is a really neat tool made by a researcher, Julie Jenkins, that she put together. And I used a long version of it when I'm working with organizations, but I put together a short version so that people can get their pulse on how are we doing with establishing a coaching culture in our organization and kind of even starting that dialogue. What would be our why for us? So all those outcome measures that we measure, every single organization has a different one. For some, it's preventing burnout. For some, it's retention. So looking at what's our why if we decide to invest in establishing a coaching culture and what's the data we need to capture to make sure we get our return on investment. So that coaching culture, I find, is a neat place to start. So lots of goodies, and I'm sure I'll think of more and add it on the page.
I love that. I love that. It really is amazing to find a gem like what you've created because you are like in a completely translational piece. Obviously, we want to work on the leaders so that the leaders can be empowered, clear, and thinking about the system and the team. And you are giving them all the skills so that it can trickle through the whole organization, through the whole culture across all professions. And both of us are aligned across all professions. And so together, hopefully, we can all transform healthcare one person at a time. And so, Helene, it's been an honor to work with you and have you on the podcast here. I'm looking forward to amplifying your message across many specialties and professions and seeing your work grow and grow. And so thank you, everybody, for listening thus far. Thank you for all the gifts that Helene is giving us. And so we'll put on the show notes below on YouTube, Apple, and Spotify. And please, questions, email us, podcast@transforminghealthcarecoaching.com so that we know what you want to listen to. And thanks so much, everyone, for listening. Please like, share, and subscribe. And you can accept this challenge and hopefully pass it forward. Thanks for listening, everybody. Thanks so much for listening. If you found value in today's episode, please subscribe and share with a colleague who would benefit. Together, we can transform healthcare one person at a time. Find us anywhere you find your podcasts. Ready to take your healthcare leadership journey to the next level? Book a discovery call, free, at transforminghealthcarecoaching.com to explore our personalized coaching packages designed specifically for healthcare professionals like you.